tell us a little bit about the Women's Center.
Sure.
And its role and how it wonderfully serves our community.
So I work for Nash OB-GYN, which is a private practice office that is located on the hospital campus. And then we do all of our deliveries as well as gynecologic services at the hospital. The Women's Center is exclusively for pregnant women, particularly those over 20 weeks of pregnancy. Less than 20 weeks, they're typically seen in the emergency room, but any pregnant woman who's over 20 weeks can present to the Women's Center. There's a registration desk there. You don't have to go through the emergency room. And there is a triage area that is to assess women who have a complaint where maybe they're not exactly sure what's going on. And then we have 6 labor and delivery suites, which are exclusive for women who are in labor or who may be having a medical problem that might be a reason for them to need to have their baby. And then we also have a surgical OR that's dedicated exclusively within the Women's Center. Within each of the labor and delivery rooms, there's plenty of space for your family. There's the bassinet for the baby.
Pediatricians come there.
It's actually neonatologists.
Oh, it's even better.
And so the hospital formally employs neonatologists who are available dependent on the circumstances of the delivery. There may be respiratory therapy, there may be special care nursery. We can take babies that are at least 32 weeks and above in our special care. Our special care nursery is quite unique.
The 32 weeks and above mean it's 44 weeks normally a pregnancy.
40 weeks is pregnancy.
Okay.
If they got to 44, that would
Okay,
be bad.
I told you I ran, right, from OB. So 40 weeks is a normal pregnancy. So
40
if they're
weeks is the due
born
date.
34 weeks.
Right, and so as long as the pregnancy is at least 32 weeks along or later, then if the woman needs to deliver, she is able to stay locally here. Our neonatologists feel comfortable taking care of that early gestational age.
And the neonatologist is a specialist in newborns.
Correct. That's somebody who got training in pediatrics, taking care of children, and then did 3 years of additional training exclusively taking care of babies. And the Women's Center upstairs has 16 postpartum suites. And so those are for women who've had their baby. Sometimes they need to come prior to having their baby. Ladies who have hyperemesis or significant nausea and vomiting of pregnancy. Kidney infections can sometimes happen in pregnant women, and that's
So they can
another
stay
reason.
a few days to manage those medical problems.
And then there is also a 10-bed neonatology unit that is quite luxurious in that even though the babies are quite small, the rooms are quite large, and so there is a bed or a couch that turns into a bed, a rocking chair. There's a shower that's for parents' use. They can order meals while their baby's there, and it's the only unit in the hospital that accepts visitors 24 hours a day, 7 days a week.